pain for last 3 years following a cricket match, sudden jerk and pain, and there was subsiding with the medicine and the conservative treatment for last 3 months. He is having severe pain, incapable, not able to stand, scoliosis, pains, tingling, numbness, weakness, no bladder bowel movement. You can see the desiccated disc L5-S1. He is only 34 years and there is a disc herniation and compressing to the right side nerve root here. In the axial view, you can see the right side nerve root is completely compressed. It is a central to paracentral area, right side, and this is almost like a extruded part of the disc. So the incision will be around 20 to 25 millimeter. Data change करे कौन है जो असुविधा এটা লগে নথিলা से छाड़ से so incision about 20 to 25 millimeter long, 10 millimeter away from the midline. से जो कैमराटा गोटे पाखु आण दिशुनी इनसिजन दिशुनी तर देखुली आज वीडियो किसी इनसिजन दिशुनी यही जिनसटा दिशुनी खाली हाथ दिश तो hemostasis is maintained with the normal the regular bipolar cautery. देखा हो जेटा भितरटा देखा ना खाली उपरटा देखा देखा इनसिजन देखा so the incision is about 20 to 25 millimeter long, 10 millimeter away from the midline. The deep fascia incision in the same line of the incision, and then subtissue dissection from the midline with the Mayo scissor. Now I am filling the superior lamina, spreading the scissor over the lamina, so the soft tissue will be dissected with the help of the chisel. Again dissection subperiosteally, then with the help of the gauze piece also we are dissecting both cranial and caudally a bit, so that we can create a space with the gauze piece tied with a thread. That is one cranial and caudal. So we are creating a space close to the spinous process to dock the instrument. This is my outer tube with the trocar. I am rolling over the superior lamina here, then pressing both the side of the tube and cleaning the soft tissue. From the lamina, the cleaning you have to give at least 1 or 2 minutes time. Sometime proper cleaning is very important. Then cleaning the window also, soft tissue from the window, and soft tissue should be cleaned from the superior lamina. This is the L5-S1 right side, so L5 lamina I am just cleaning. This is my spinous process, spinal laminar junction. Now cleaning with the gauze piece the window and the superior lamina. So once everything is cleaned, then I am putting my inner tube. Now inner tube should be locked with the telescoping locking system. Now cleaning the suction tip and then cleaning my fingers. so that the movement will be smooth and free. Index and thumb is controlling the suction, middle finger and ring finger controlling the stability of the 3D glasses is a must. Without that we are not able to see. लाइट ये टायर नहीं जैसे आउट दे चलो. So this is the inside picture. This forceps. This is my superior lamina. This is the spinal laminar junction, and this is my facet. This is the inferior lamina here. This is the inferior lamina. So cautery, the hemostasis is maintained with the light टिके दे ना लेकिन देखा जी outside picture. चल गोटे लाइट तो एपट को दे. हाँ हैंड मूवमेंट जड़े केम देखियो. So this is the endoscopic bipolar cautery I am using now. देखा जी outside picture ना. Outside picture है जी तो light नहीं ना थी. Light टिके लगा. बस चलो drill. So drill foot switch. Now this is the spinal laminar junction. I start from the spinal laminar junction. This is my standard, and I think most of the people prefer to start from the spinal laminar junction where the dura is little away from the bone. So this is the safest place to start with. I am now cleaning with the gauze piece. Gauze piece now cleaning the debris of the drill, and now putting the inner tube and locking with the locking system, that is called telescopic locking system. Now instrument is docked, the inner tube and the telescope is locked. This is a 0 degree telescope, 4 mm 3D disc. Now I am using the disc forceps to remove the superficial layer of the flavum. This is the superficial layer. The 45. So superficial layer is now removed. Now the deep layer is in front of me. It is very clear now. Deep layer of the flavum. The first bite at the spinal laminar junction. So midline the dura exposed. Now gradually I am coming laterally. This is my 3 mm Carison punch. 3 mm 45 degree. So trimming a bit of the bone from the cranial lamina to detach the flavum here. Now the flavum is detached at the midline and spinal laminar junction. Gradually I am coming laterally. Look ready करायची. The lateral aspect of the facet. This is my inferior lamina here, and I am trying to detach the flavum from the inferior lamina. Now it is detached. Little bit of trimming of the bone here. This is foramen, so I am doing little foraminotomy to decompress the nerve root up to the foramen is a must, so that I can very easily mobilize the nerve root medially freely, so that I can approach. I'll get the space. चल spatula. This forceps. The petty. Now both the cranial and caudally, the deep layer of the flavum is detached. Now for the safety purpose, for the protection of my dura, I am putting the cranial petty now. Now one more petty caudally, one more cottonoid. So this is my caudal cottonoid. Very tight canal, and this is the dura. Below it, this is the flavum, deep layer of the flavum, the disc forceps. Camera approach. The 45. So this is my flavum again. This is the SAP, the medial aspect of the supraarticular process. The hypertrophic portions of the SAP. My nerve root is in front of me. I am trying to remove the petty, remove the bit of the medial aspect of the SAP, the dispersor. Petty. Now this is my cranial petty. I just change the petty so that I can dissect the nerve root a bit medially, push the medially and see where I am. Yes. And this is my nerve root. You can see my nerve root here. This forceps. Spatula. So repositioning of the petty, the caudal petty here. I am trying to dissect the soft tissue which is bit adherent here, because the history is almost 3 months. Now nerve root and mobilizing nerve root here. So with the nerve root now clear, the disc per side. So this dissection very vital, so that you can see the structures, anatomy, otherwise you will be in trouble. This anatomy is very important. Identification of the anatomy, then proceed. डाक तांग लोग को डाकी दिया चल और पेटी so cranial petty. Now you can see the face of the disc here. This bit height here. See, this is almost a paracentral disc. So big disc, the petty. Now I like to put this petty enter to the nerve root. That's why I remove a bit of the bone from the foramen and foraminotomy, so that I can mobilize my nerve root here. Artery. So mobilize the nerve root medially. So, this is my nerve root. असली तांग लोग को देखा. So this is the dura. एटा होची तार स्पाइनल कॉर्ड, तादर बाहर ची नर्व, एटी तार डिस्टा अछि. ए डिस्टा बाहर की आसी कि ताको चिपी के मारुची तळे. देखि परछन्ती एटा ए धଳାटा दे. तो सेटा को हमको बाहर करियार अछि. से ता तळे बसची, बड्डडा बसची एटी. ए फुटी के बाहर लाबे महादेव देखले. ए बाप रे पूरा पसी जाई भितरे आ. सेति पई ता कष्ट होची एते जोरे. पूरा extruded and migrated. दे. Now I'll just extend the tear. It is already torn, the annulus, and that has come out, extruded. That's why the cause of the pain. I have extended the tear.